Hello, and welcome to Epi-Center. If this is your first time tuning in, I'm so glad you're here. And if you've been listening for a while, thank you for sticking with me. My name is Camilla Foy, and today we're going to talk about something that often hides in plain sight in epilepsy care: anxiety. Not just occasional worry, but anxiety that becomes a diagnosable disorder. A condition that coexists with epilepsy and makes life so much more complicated than most people realize. Now, before we jump into the numbers and causes, I want to clear up an important distinction. Anxiety in epilepsy can show up in two ways. Sometimes it's part of the seizure itself, and other times it's a separate psychiatric condition. These two aren't the same, but they can look similar, which is why people often confuse them. Seizure-related anxiety, also called periictal anxiety, happens in three forms: before a seizure, or preictal; during the seizure, ictal fear; or after, postictal anxiety. These episodes are brief, often stereotyped, and neurologically driven. They're not what we would classify as a comorbidity. What we're focusing on today are anxiety disorders as comorbidities, meaning they exist alongside epilepsy as independent conditions. This includes disorders like generalized anxiety disorder, panic disorder, and social anxiety disorder. These aren't fleeting moments of fear. They're persistent, disruptive patterns that interfere with daily life and mental well-being. So, how common are they? The short answer is far more common than you might think. In the general population, about 15 to 20% of people will experience an anxiety disorder at some point in their lives. But among people with epilepsy, the number jumps dramatically, anywhere from 20 to 50%. Some studies report even higher rates when you include subclinical symptoms. Disorders like generalized anxiety, panic attacks, and social anxiety are among the most frequent, and the risk isn't evenly spread. Women tend to experience anxiety more often than men, and people with temporal lobe epilepsy are particularly vulnerable. So, why does this happen? The answer is complex. There isn't one single cause. There are multiple layers. On a biological level, the same brain regions that regulate mood, like the limbic system, amygdala, and hippocampus, are often involved in seizure activity. If those areas are disrupted, fear circuits can become overactive. Neurotransmitter systems, such as serotonin and GABA, play roles in both seizures and anxiety disorders, which means imbalances can affect both conditions at once. Medications can also tip the scales. Some anti-seizure drugs can worsen mood symptoms, while others might actually help stabilize them. Then there's the psychological side. Living with epilepsy means living with uncertainty. Not knowing when or where a seizure might strike can create a baseline level of anxiety that never goes away. Some people develop panic attacks or PTSD-like symptoms after traumatic seizure experiences, especially if those seizures happen in public or caused injury. And finally, we can't ignore social factors. Stigma, loss of independence, job limitations, and strained family dynamics all fuel chronic stress and anxiety. The impact of anxiety on epilepsy is huge. It's not just an emotional burden. It can actually worsen seizure control. Stress hormones raise neural excitability, lowering the seizure threshold and increasing seizure frequency. Anxiety can also disrupt treatment adherence. Some people may skip medications out of fear or side effects or avoid doctor visits altogether. And beyond medical outcomes, anxiety chips away at quality of life. It limits social engagement, isolates people, and makes day-to-day functioning so much harder. When anxiety coexists with depression, which is extremely common, the effects multiply, and the risk of suicide rises significantly. So, how do clinicians figure out what's going on? Screening for anxiety in epilepsy isn't as simple as handing someone a questionnaire, because symptoms overlap with seizure-related phenomena. A thorough clinical interview is essential, asking when the anxiety happens, how long it lasts, and whether it's connected to seizures. If the episodes are brief and stereotyped, that may indicate ictal fear rather than panic attacks. Tools like the GAD-7 or the Hospital Anxiety and Depression Scale are commonly used, and epilepsy-specific tools like the EASI help capture seizure-related fears. In some cases, video EEG monitoring is needed to see if anxiety symptoms coincide with seizure activity. When it comes to treatment, the approach needs to be thoughtful and individualized. Cognitive behavioral therapy, or CBT, is the most evidence-based psychological treatment for any anxiety disorders, and it's highly effective for people with epilepsy. Mindfulness-based interventions, psychoeducation, and stress management strategies also make a difference. On the medication side, SSRIs like sertraline are generally considered safe and effective, though clinicians monitor for rare cases when seizure thresholds might be affected. Benzodiazepines can be helpful short-term, but dependence and tolerance may make them risky for long-term use. Beyond medications and therapy, lifestyle strategies like good sleep hygiene, exercise, and peer support are critical to managing both anxiety and seizures. So, what's the catch? Unfortunately, there are major gaps in care. Anxiety goes unrecognized because seizure control dominates neurology visits. Stigma around both mental health and epilepsy keeps patients from speaking up. And even when anxiety is identified, access to integrated care is rare. Few epilepsy clinics have on-site mental health professionals, and referrals to psychiatry can take months. Insurance coverage for therapy is inconsistent, and cultural barriers can make conversations about mental health even harder. On top of that, providers face a delicate balancing act. Some medications for mood can worsen seizures, and some seizure medications can worsen mood. It's a constant tightrope walk. Here's the bottom line. Anxiety in epilepsy is not a minor side effect of living with seizures. It's a major part of the condition for millions of people. It affects treatment adherence, seizure control, and overall quality of life. And yet, most people with epilepsy and anxiety never receive adequate mental health care. That needs to change. Thank you so much for listening to this episode of Epi-Center. If today's topic resonated with you, please share it with someone who might benefit or connect with me on social media. In the next episode, we'll keep exploring the mental health side of epilepsy, so stay tuned. Until then, take care of yourself and remember, you're not alone in this journey.